Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I would like to discuss the treatment of what I call accordion lines, the really and truly annoying lines that happen on the lower side of the cheeks, mostly in women. They are from smiling, but as we get older, and particularly in fair-skinned patients who have had a lot of sun exposure, these lines can appear and then stay on the face even when you are not smiling. These lines can occur at a young age in some patients, but they get much worse as we get older, especially after menopause. Treating these lines are what I would call a bit of a losing battle since we cannot make them go away entirely, but it is often a battle that's worth fighting because people hate these lines. We wage the battle on multiple fronts. I like to attack these lines with multiple modalities for the best results. There are separate podcasts on most of these treatments that I'm going to mention, so if you want more information, please listen, but I will hit the high points here. First is sunscreen. If you're not willing to stay out of the sun and protect your skin from the sun, there is no point in spending money on trying to make the accordion lines better. So first, I would say the sun degrades collagen, and these lines are a loss of collagen and elastin, and no progress will be made unless the sun is kept totally off of the skin. That means sunblock, at least an SPF 30 or above, a wide-brimmed hat, a baseball cap is not enough, and reapplication of sunblock every 2 hours. Sunblock and makeup is not enough. Sunblock only lasts about 2 hours and must be reapplied. For women who wear makeup, powder sunscreen is a really nice option to carry around in your bag or in your car if you don't want to reapply sunblock lotion. And there's an entire podcast on sunblock if you want more detailed information, but sunblock is the first battle that we need to wage against these lines. Second, good skincare. There's an entire episode on anti-aging skincare, but the high points are like this. Retinoids, such as Retin-A or retinol at night, can definitely help smooth out the lines. They can also help reverse some of the sun damage and stimulate collagen to grow, but not everybody can tolerate them. So other alternatives would be glycolic acid, which is not quite as strong and easier to tolerate. Also, peptide creams can be helpful. And then there's, of course, vitamin C that is best used in the morning underneath the sunblock. Keeping the skin moist is really important, as dry skin makes wrinkles look worse. So, again, listen to the podcast if you want more information on these products. But retinoids, glycolic acid, peptides, vitamin C, those are the basics. Third, we need to stimulate collagen to grow with treatments. Good choices are Fraxel or Clear and Brilliant laser resurfacing, also Ultherapy or a different ultrasound or radiofrequency device, and I also like photofacials or intense pulse light that I would put into this category of collagen stimulatory. Each of these has its own podcast, so give a listen if you want to learn the differences between these treatments. But briefly, Fraxel is a series of 3 monthly laser resurfacing treatments. It causes redness for a few days. It hurts a little bit. It is tolerable, and it is fairly aggressive and works well. Clear and Brilliant is what we would call a baby Fraxel. It's made by the same company. It's really just like a lower level of Fraxel. It's the same series of 3 monthly treatments, but the redness only lasts a day or so. It's not as strong. Ultherapy is a deep ultrasound treatment, and it has no downtime, but it hurts when you're having it done, and there's really no good way around that. We typically do Ultherapy once a year or so. Once in a while, we'll do it every 6 months. And photofacials are no pain, no downtime, but it's a series of 5, once a month. Whichever we choose, these must be done on an ongoing basis, and sometimes I will do a combination of these treatments for patients. We all lose collagen as we age, and so these treatments have to be repeated again and again and again. Fourth, after good sunscreen, good skin care, and collagen stimulatory treatments, are fillers. We often need to do some fillers into these lines. If they are very deep, then most any hyaluronic acid filler will help soften them. But often they are not very deep. They are very superficial, and we do not want filler to make them lumpy and bumpy. So I will often choose Skin Vive as my favorite filler here, since it's really a skin hydrator. It's a very thin version of hyaluronic acid, and it helps to smooth out those lines. Fillers are easy for me to do, but they can cause bruising, and they do need to be touched up probably twice a year for most people. I would say RHA2 is another filler that I like in this area, but there are different varieties of fillers that can be used for different people, and there's an entire podcast on fillers if you would like to listen to that. So in summary, the accordion lines on the sides of the cheeks are what I would call a bugaboo. They are hard to treat, but for patients who are willing to put in the time and effort, we can make them better. It's a multi-pronged approach of sunblock, moisturizer, good skin care, collagen-stimulating treatments, and fillers. And when we do those all together, we get very nice results over time. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, Board Certified Dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.